Okay, folks, I believe I am recording, and I am very pleased to welcome you all here today. My name is Neville Swade, for those that I have not yet met, and I run the Access program, and we're running a series of conversations on climate change, which we started last year. And what we're doing with these is making these events headline events designed to spawn further in-depth discussion on the topics that we get to. And really, it's born out of the fact that a number of things have happened, but that there are really some fundamental developments in climate change in all spheres and aspects of it. And so we really want to do is look at these quite basic elements of the climate change discussion and to broaden transdisciplinary thinking around climate change. And so trying to bring people from different fields together and really to put climate change back on the agenda, given that it's been so overwhelmed the last year by COVID. And then to fulfill our mandate, which is to grow the climate change research network. These conversations then are very broad ranging, and we've had a few so far, and there's a link which I'll put into the chat in a minute on YouTube for the previous events. This next slide will just give you a flavor of the kinds of topics. We've had one on climate change law, one on wildfire, one on the big 2020 biodiversity impact reports. We had one last week, in fact, on the cryosphere, and this week, very glad to be having one on climate change and health, particularly for me, because this is an area I'm especially interested in. And we're still planning some more, which we'll announce shortly on economics, on ocean acidification, on politics and climate change, and we'll look at COP17, potentially some other issues, and then we'll get back to some of these topics and go over them again in a bit more detail. So that brings us to today, and very, very glad to have an awesome panel chaired by Bono for us. And for those of you who don't know Bono, she is the Deputy Director at the moment in Department of Health, Department of Health, and she is the Deputy Director for Environmental Health in the National Department. And she focuses mostly on climate change, vector control, and air pollution. She's held various other positions, both in the National Department and in various regional departments. And she's a colleague of ours, and I'm really pleased that she is going to chair this afternoon's session. And then just to say that I'm particularly grateful to Madeleine Thomson and to Karadji Wright, who also agreed to give us input today. Bono will introduce them both. But what I am going to do is just while she's doing that, put in the link to Madeleine's book, which I think is something I can personally recommend because I have a copy on climate impacts on health and with a particular focus on Africa. So with that, I'm going to hand over to Bono and say thank you very much. And Bono, the floor is yours.
Good afternoon, colleagues. And thank you for this opportunity. Hopefully you can hear me. Neville? Oh, okay. Thank you. We really appreciate the platform that has been set by Access together with Department of Science and Innovation to engage in these discussions in terms of climate change and health. Antonio Guterres, a UN Secretary General, in his opening address remarks in 2018 at a press encounter on climate change, he indicated that, I quote, "The headlines are naturally dominated by the escalation of tensions and conflicts or high-level political events, but the truth that the most systemic threat to humankind remains climate change," close quote. This afternoon, the Department of Health has joined stakeholders in conversation on climate change and health, and as a sector, through the guidance of Department of Environment, Forestry and Fisheries as champions of climate change in the country and World Health Organization, we have developed policy guidelines or a legislative framework that responds to climate change in terms of health. We have the National Climate Change and Adaptation Plan 2014-19, which is under review. And we have also the draft National Heat Health Action Guidelines, which is also awaiting approval by the department. Climate change and health is the program which still need more research, and that we have seen when we engaged in a project or program in 2019-2020 with Department of Environment, Forestry and Fisheries, when we wanted to have a look at the research that are available in terms of climate change and health. And I can gladly say we had few, but we still need more to be able to guide us in that particular aspect. Today, we are in this platform as we engage two researchers who will give us presentations on climate change and health. We will have both presenters presenting and then take questions. After each and every presenter, we will have questions, and we want to encourage participants to ensure that those who can be able to ask questions via the chat, they can also do that. We will definitely, between me and Neville, we will note them and be able to engage as we move forward with the program. So without wasting any time, we will start our conversation with Dr. Thomson. Dr. Madeleine Thomson is a senior climate change lead and acting head of Our Planet, Our Health program at the Wellcome Trust, a politically and financially independent foundation focused on improving the health of everyone by helping great ideas to thrive. The trust supports researchers, policymakers, and the public in tackling today's health challenges, including those associated with climate change. Dr. Thomson is also a visiting professor at Lancaster University, UK, and an emeritus professor at Columbia University, New York, where she previously held senior research positions at the International Research Institution, IRI, for climate change and society and the Mailman School of Public Health. While at IRI, she served as director of World Health Organization Collaborating Center on Early Warning Systems for malaria and other climate sensitive diseases, including meningococcal meningitis and Zika V, and was co-chair of Cross-Columbia Working Group on Global Health Security. Originally trained as a field entomologist, she spent much of her early career undertaking operational research to support large-scale health interventions in Africa, e.g. National Impregnated Bagnet Program in the Gambia. She was educated at the University of Sheffield, where she obtained her BSc, and Imperial College London, where she did her Masters in Science, and the University of Liverpool, where she graduated with PhD. On that note, the floor is yours. Dr. Thomson, please take us through your presentation. Thank you.
Thank you so much. Can you hear me clearly, Chair?
Yes, I can.
Yes.
Okay, excellent. So first of all, I am really delighted to be part of this conversation, and I very much support the Chair's request that if people have questions following my presentation, that they provide them in the chat or ask them later. I'm very keen to hear from you. As you've heard from a quick rendition of my personal history, you'll know that I'm talking about climate, but I don't come from the climate community. I very much come from the health community. And I very much, as you will see through my presentation, look at climate through a health lens. My main experience of this has been working, as mentioned, at Columbia University, where I was for 17 years working with climate scientists, very much focused on the use of climate information for improved development decisions, whether that was in agriculture, in water resource management, or in health. So, interesting. Neville has mentioned the book that I published with Simon Mason. So Simon Mason here is the climate scientist, and he has a lot of experience working in Africa. And together we put this book, which is open access. It's appearing in a number of libraries now in Africa, but you can just access it openly online. And that was to kind of consolidate the ideas, the practical issues that arise when health people want to talk to climate people and use the knowledge on the climate to improve health outcomes. So I'm going to start just by saying, well, of course, many of us here on this call recognize that there are direct relationships between climate variability and health, and also many indirect relationships between climate variability and health, which are manifest through a range of socioeconomic effects. So the ones that I'm going to focus on today will be more the direct effects, but that doesn't mean the indirect effects are not important. So here you can see all of the different pathways, if you like, that climate can have an effect on health, whether it's through pollution, through migration in response to droughts, etc. And the entry point for me, if you like, is through infectious disease, and particularly because of my career as an entomologist, through vector-borne diseases. But many of the issues and the that I will highlight through my talk actually apply fairly broadly. So the first thing to think about when we have so many different insects around the world, some of which, and actually a relatively small proportion, are of serious impact on human health. The first question, and this is a question, is like, why are insects so related to climate? Why is climate such an important factor for vector-borne diseases? And the first thing is seemed kind of obvious. Insects are very small generally, and therefore they have a large surface ratio to their volume. And because of that, they tend to lose water very easily. So they have a range of mechanisms to stop losing water. One is to obviously the cuticle, if you like, on insects retains water. They often have behavioral mechanisms or physiological approaches to reduce water loss. The other thing is, of course, that is very important is that they are poikilothermic. They don't create their own heat by and large. And because of that, they don't maintain their own body temperature. They really are at the temperature of the environment. So the fact that they're very small and the fact that they're poikilothermic means that they are innately related to environmental drivers. And of course, the very many pathogens that they carry are then carried within an insect which is connected to the environment. So if the insect itself is not controlling its temperature, but is it at the temperature of the environment, then any pathogen that they carry will also be at the temperature of the environment. And as we know, with all biological processes, temperature is critical in terms of development rates, the speed of maturation, etc. And just based on those simple principles, I now want to take you through, and I'm assuming here on the call that there are many of you coming from the climate side that maybe not so familiar with health, and that some on the health side not so familiar with climate. But a model is how we kind of link the two pieces together. We create a model which looks at the climate and environmental drivers of a health outcome. And the first thing we need to do is have a problem focus. So we could take a vector-borne disease, and then the model will incorporate potentially the vector itself, the pathogen, and the human host. And I want to introduce you to these three concepts on the right-hand side and why they're important. We need to, in the development of the model, take into consideration what we call are the boundary conditions, the initial conditions, and the parameter setting. So boundary conditions include things like the measurement of climate. If we say that the model is going to be driven by climate, and we're going to use that information to drive the model, and the model is going to cover a certain area, how certain is the climate information for that particular location? Of course, we can measure climate, but for the particular issue that the model is related to, the boundary conditions, which imply how good an estimate of that climate is a very important part of the model development, and is something that I will touch on later. If we look at the initial conditions, well, a very common initial condition would be, well, how many infected people are there in the population? This is particularly important for COVID, but it's also important for vector-borne diseases. How many people are infected, how many people are immune, etc., etc. And if we don't know the initial conditions, it's very hard to run a model, because you could have all of the perfect conditions for disease transmission, but no infected people in the population. And as a result, you will not have any transmission of disease. So initial conditions are very important. And the third one, of course, is that our models, which could be statistical or mathematically based, we've got to set those relationships, and those relationships and the way that we set them, if you like, are a very simplistic perspective on the reality of the conditions in the world. So how close we are to reality and the way we set our parameters is going to obviously improve or not the way the model can describe the environment that we see. And we've seen, and I'm sure in Southern Africa as well, people have been following models on COVID, but there are also all the models on malaria transmission and many other diseases where different modelers develop sometimes the similar, sometimes different ways of trying to express what is happening within the disease transmission cycle. And once we get to the point where we have a model output, we want to know, does that model actually reflect reality? And so we have to compare it with a predictant of some sort. And very often when we compare it to a predictant, we realize that there's quite a lot of uncertainty in the predictant itself. So the predictant, for example, could be observed cases at a facility. But what proportion of people are going to the facility? How good is the diagnosis, etc. So it's quite hard even to test a model output against a predictant. And with the validation that we can do, we have two pathways, if you like. One is, what's the scientific interpretation of those results, and can we then improve the model by either improving our understanding of the boundary conditions, the initial conditions, the parameter setting? Can we improve the predictant, etc.? And then from the decision-making perspective, they might be like, well, actually, was this the right problem to focus on? Should we be focusing on, did we describe the problem correctly? So I want to emphasize that when we think about driving infectious disease models through environmental and climate data, observations, the initial conditions at the beginning of the process are already sufficient in some ways to provide some predictive capability. And you can see here a graph first. The initial conditions might be, are there vector breeding sites? Are there gametocyte carriers for malaria? What's the specific temperature range in this environment? And are there susceptible people? And then it will take some while for the mosquito population to develop. It'll take some while for infected mosquitoes to emerge. It will take some while for the disease to develop in the human population, and it will continue to take some time before those cases emerge at hospital facilities. So you can predict with initial conditions several weeks or months ahead of a particular disease. And that's really important for climate people to understand, because climate folks from my experience, often are very much focused on predicting the climate and using the climate predictions to predict the outcome. But we can do both. We can predict a health outcome from the initial climate conditions as well as their forecasted ones. And I want at this point to think about just how one might use climate information across a range of decision making processes. In the short term, we have, say, less than 2 years planning cycle. Seasonal planning, really important for the health sector, fits in with the annual planning and commissioning cycle. It fits in with epidemic and disaster response. You can see whether or not what you're doing is effective in a relatively short time, and that's a good thing for donors. So there's a lot of interest around weather and climate and its relationship to health outcomes in short timeframes. But one of the things we know is that we also have to look at the policy time cycle. And that policy time cycle tends to be 4 to 5 years, where you might get reorganization of the health service. That might be the length of the grants that people have access to. So the types of information that would be relevant in that time cycle might be a bit longer than just 1 year ahead, etc. So, and then we have opportunities around strategic planning. What are the medical countermeasures that need to be developed? We've had phenomenal development of vaccines for COVID, but we still know it's going to take several years before the whole world is vaccinated. But developing countermeasures ahead of time, those platforms that we have for COVID were built and already functioning before COVID hit us. And that is one of the major reasons why we have a capability to build vaccines and create vaccines now. So thinking ahead strategically, what needs to be developed to be able to respond rapidly to climate-related events is going to be really important. And then for the longer time frames, thinking around the way climate information can inform our emissions reduction. It's very important to understand what we need to do today to impact on the future, how malaria eradication strategies or other long-term disease plans might be understood in the context of a changing climate, and then infrastructure investment. We know that health sector are susceptible to climate events, and resilience is needed for that. We need to build the workforce knowledgeable on climate and climate impacts and how climate information can help in those processes. So just want you to think through in time the types of decisions that are relevant, and then the types of communities that you would engage with, whether it's policymakers or practitioners or different agencies that would need to be engaged in the process of developing a climate-informed health delivery program. So just to stand back a little bit and show how important global and local processes are. This is a graph of that red band that you see above, which is the tropical zone. And there we can see in the graph below land surface temperatures in that tropical zone and how they've warmed over time. And you can see this general warming trend from 1982 through to 2010. And the dotted line is the tropical sea surface temperature. So what's happening in the sea while warming is happening on the land. And you see that they're very strongly correlated. And not only that, but the red and the blue marks below show where you get variations. So you get variations in that warming trend associated in part with, I've marked here a couple of volcanoes that went off, the Chichen eruption and the Pinatubo eruption. But in particular, what drives that up and down is the relationship of global sea surface temperatures to El Nino and how that impacts on temperatures on the land. And we can see how that becomes manifest locally at very specific areas in time. One of the challenges about using climate information to forecast into the future is that all data timeframes are not equal and you can't treat them in the same way. So we have pretty good weather forecasting, certainly in the temperate zones. As you will see, that's one of the regions where weather forecasting actually works best, and also there's a lot of capability within the weather organizations. But it's quite hard to know what's going to happen with the weather anywhere in the world in 1 to 2 weeks' time. It's again, we have some seasonal predictability, particularly in some parts of the world, but it's very difficult to know what's going to happen with the climate in 5 to 10 years' time. And then we have some very strong warming trends, which we know will continue into the future. And it depends very much where you are in the world to know whether there's any predictability on the rainfall side. So just to reiterate, these maps look at temperature and rainfall predictions at 3 time scales. The weather time scale works best in the extratropics, but you do get some weather prediction elsewhere. And obviously that can be useful, particularly for disasters. But at the seasonal time frame, and particularly for rainfall, it's the tropics which have the highest level of predictability. And the extratropics, certainly where I am in the UK, it's quite difficult to create estimates of the season, good estimates of the season ahead. I have to say that the temperature in the central graph here is red everywhere, suggesting that you can be predictive of the warming climate, but a substantial component of that is the fact that we are just getting warmer anyway, and that is a big confusion. The climate change trends and the variability are hard to separate out. And then when we look at climate change models, that's obviously, we see these long-term risks that we're already experiencing the early phases of, but it's very hard to know with certainty how robust they are in different parts of the world. So we know that these long trends, term trends are baked in. What happens locally, though, will depend on the local climate as well as the longer term changes. So just thinking about the African context, we have a very strong El Nino effect, particularly in East Africa for wet, the Sahel for dry, and Southern Africa for dry. And these signals are used by your Met services to inform a wide range of sectors. In Southern Africa in general, there are challenges around countries that interface between the eastern wet zone and the dry zone. For instance, Malaria, where you'll get an effect of an El Nino in different directions in different parts of the country. But I just want to use this, and some of you may have seen one of my early papers on this was to look at Botswana in particular, look at the malaria data in Botswana, look at malaria anomalies, and then relate those anomalies to the climate of Southern Africa. And what we saw early on was that the high malaria years, and there were 5 of them which were unusually high, and the low malaria years, and we had 5 malaria years which were unusually low, corresponded very well for Botswana with observed rainfall. So high malaria associated with high rainfall in the top graph, and low malaria associated with low seasonal rainfall at the bottom. The question we had in this research was, well, we can see it with the observations, but can we see it with seasonal climate forecasts, operational forecasts? And focusing in on Botswana, we absolutely can. And the diameter forecasts on the right were the first real evidence that you could provide predictions of malaria using seasonal forecasts at the larger scale. It became much harder to devolve those analyses to district-based studies. They have been done to a certain extent, but and the major challenge there was that the climate data that was being used was very large scale climate data, the sort of data that climate scientists like to play with. Staying at that scale now, this is with another rainfall data set and looking across the continent, we can do simple analyses that show how well different seasons and different regions respond to ENSO events. And this one here looks at El Nino and shows that you can see really strong effects in the October to December season. In Southern Africa, you don't get an effect, but you do get an effect in East Africa. In the Sahel and Ethiopia in particular, You get a very strong effect in July to September, but not so in December to February. And in Southern Africa, as we've mentioned, you get a very strong effect on the rainy season. What you don't get is the March, April, May season, which is a very important season for Eastern Africa. There is no ENSO signal. And this all has implications about how you're going to use climate information. Unfortunately, when you get into forecasting, it has to be, is that information suitable for that place at the right time? So I want to emphasize that when we think about linking climate and health, we can link it in the context of improving our understanding of disease. We can look at the spatial risks to populations. We can look at the seasonal risk. And I think this is particularly the starting point for virtually all of our climate related work. There is some effort on sub-seasonal and year-to-year changes that allow us to develop early warning systems. And there are trends in risk so that we can identify longer term shifts in the climate and what that poses to climate sensitive diseases. The last one of all, which I think has actually been the most important piece in terms of the work that we've done, is to show that for many diseases, even if you're not thinking about how are we going to respond to climate change, climate is impacting on the assessment of the impacts of your interventions. So if you run a malaria program and you don't factor in the climate, you won't have factored in whether droughts have actually been helping you in deliver your intervention or hindering you from delivering your intervention. So those are the areas and ways that I think we can move forward. So climate, as many of you know, is predicted and measured through a range of tools, whether it's observations, buoys at sea, remote sensing tools, and of course models that we use. But surprisingly and challengingly, it's still in the African context in particular, there are huge challenges in the quality of the data, substantially because of the lack of observations that are used in these global data sets. So these observations, sometimes they're missing, sometimes they're not being made available to the global community. So the global data sets are not being, if you like, tailored to the African context. You can see in South Africa a much better situation than many other countries in Africa, but still the whole region, by and large, underserved by climate data. And so one of the activities that I've been involved with for quite a number of years is to think about improving the availability and access and use of climate information. And to do that, we need to do three things. We need to make sure the data exists, make sure it's accessible, and make sure that it's useful and used. So I'm going to, through this talk, you'll find a number of links. So those of you who wish to follow up on any of this should hopefully be guided in the right direction. But I just realized that I don't have, I know I can put a time thing there, to stay in reasonable time. I'm going to just talk about the ENACT initiative in Africa and what a difference that has made. And the initiative basically sets out to combine at the national level, by the National Met Agency, the national databases in real time or in retrospective with all of the other information that they have available, their digital elevation models, reanalysis data, satellite data, etc. And what you get there is by combining it at the national level, because the Met services, and this is an example from Ethiopia, will not give all of their data to the global community, you suddenly get the highest resolution, best quality products that includes both all of the global data that's relevant and all of the underlying national data. And they then put that data, the images of it and tools to analyze it on their website. And we've seen this now across a whole number of countries in Africa. And the big advantage is this. On the left-hand side, you'll see the data the Ethiopian Met Services provides for climate analysis, 27 stations, and that's what goes into the global products. Their own data set for monitoring includes over 100 stations, and their historical data sets, which they have in their archives, which provide a really solid foundation for climate analysis in Ethiopia, are hundreds and hundreds of stations. I think even coming up to 1,000 stations now. So compare 27 stations that goes into products like chirps and into the reanalysis data, etc., with 1,000 stations that the Ethiopians themselves have. So with the high quality data, then you can start creating tools, and this is just a simple analysis tool that allows you to look in Ethiopia, if you go on their website, at the history of climate in the different regions. How variable is it? How persistent are the droughts? Which regions of the country respond to El Nino, etc. We've done examples of this, detailed studies connecting this high resolution data to malaria data and malaria models in Ethiopia. And you can see that these generalized warming trends in Ethiopia are exposing many more people to malaria than what would have been prevalent 30 years ago. And you can do that simply because you have the quality of the high resolution data. In Tanzania, similar efforts, and this is how the map rooms look. Unfortunately, Tanzania's map room, if you went on site now, is probably, I'm not sure if it's up and running. They have had a lot more resistance in terms of sharing their data than in other countries. So each country varies in what they've been doing, but the tools, technologies, and ways of enabling countries to share their data have been significantly enhanced. And I can just show this example on the monthly climate analysis allows them also to look at the seasonality, the trends, and where El Nino is going to have the biggest impact. And this was all used in studies on malaria in Tanzania, whereby you could see fairly precisely and in which districts you had really strong ENSO effects. And for this example, it was a very important analysis for the President's Malaria Initiative, which was funding Tanzania hundreds of millions of dollars for malaria control. They wanted to look at the baseline year before they started, and then the intervention years to see how their dollars had improved child survival, etc. And what we were able to show was that the impact of ENSO in Tanzania in 97, 98 was massive. So if they used, as they were planning, 95 to 99 as the baseline year for malaria, and then compared it with everything after 2000, then 2000 they went into several mega droughts, and malaria would have gone down anyway. So they'd set themselves up with a very high malaria base, an unusually high malaria base, and then a whole period of drought. And not surprisingly, malaria records went down. Now they have to be able to separate out the climate, if you like, to give an honest assessment of the impact. And what resulted from this was that they could put in the timing of the different interventions and then say, well, we'll start from 2000 to 2005 as our baseline, because not many interventions had happened then, and then look after 2005 afterwards. So similar example for Kenya, where 97, 98, the big El Nino that happened there, you could see it in the observations. And here the observations are the blue bars, and malaria, big epidemic spike that happened, catastrophic epidemic that occurred there. But when you look at it in Kenya's new map room, not only can you get the assessment for the whole region and not just for one particular Met station, but you can compare it against El Nino. You can see a map of the whole country, what was happening at that time, and where ENSO was going to have the most effect. And that means you have space-time tools that allow you to then integrate this information with other data. So I just wanted to make sure that we have plenty of time for conversation. My thought here for engaging the health community in using climate information in decision making, which is a central part of not only managing climate issues today, but also into the future. And that is, first, think of the safety of the data. Is the data safe to use for a particular problem? I would argue it's unsafe to use climate change scenarios for short-term predictions. They're not working on the same time frame. Is it efficacy? What's the efficacy of the data? Will using this data be appropriate for a larger region? If it's just for that particular Met station and that particular relationship, then you can't really use it in decision making. You've got to understand how relationships that are identified can apply across the same eco-epidemiological setup, as well as maybe multiple eco-epidemiological regions. And then finally, the actual relevance of using climate information and climate knowledge to improve health outcomes in a changing climate is, at the end of the day, does it make a difference to health? So you've got to understand, is it going to be impactful? And that doesn't mean just scientifically. Sometimes we can find all sorts of significant relationships scientifically, but do they matter? Will they actually be relevant to the question in hand? So, and with that, I just want to say, I saw Neville pointed out some of the discussions that have happened through this particular platform and the focus on COP. I did want to get into the mindset, but maybe Neville will be following this up in a separate meeting. COP27 is going to be in Africa, we know. It's a huge opportunity for the health and climate community to come together and showcase not only what they can do, but what they really need to advance. So with that, I'd like to thank you. And I've put a few links in the base here.
Thank you, Madeleine, for the wonderful presentation. And I'm happy that in the platform, we also have colleagues who are driving the malaria control program in the country. And they have taken note of what you have been presenting about. I saw that most of the examples of areas that you touched based on were focusing on malaria. So we really appreciate that particular presentation. We are opening up this time for questions. If we've got questions from someone is saying can't hear me clearly. Can you hear me now?
Yes, yes.
Oh, okay. Thank you. Yes. So I'm opening this time for questions. If colleagues have, you can raise your hand and be given a platform to ask your question, or you can put your question in a chat.
Bono, there are 2 questions in the chat already.
Okay. Can you please assist with reading those?
Sure. The one question is from me.
Okay.
And it is, the question is, as climate change proceeds, do the established relationships that you are displaying between climate and diseases like in malaria, do they change and shift? For example, are incidence patterns shifting with latitude and with altitude as time goes on? So that was really my question. And there's one following up, which I'll quickly ask, and then you can answer both of those. The question is from Tariq, who asks that they've read that there are many shortcomings of government policies and interventions on climate change that occur because they are informed by social and behavioral changes and theories and ideas. Social and behavioral change campaigns don't usually include a component that challenges motivation and emotional effects associated with changing one's behavior. So the question is whether there are interventions that acknowledge the emotional impact of changing behavior as a barrier that needs to be addressed. Those are the 2 questions that are in the chat.
So the first question, I think at the moment, there are obviously, with a changing climate, if there's usually somewhere else in the world that has the same climate as the climate we're changing into. Yeah. So if the Northern Hemisphere is getting warmer, we look south and we say, you know, the UK might become like France, or might become like Greece, or, you know, so there is some corollary with what's going on elsewhere. And the relationships that are the biological relationships are, I would say, kind of are more fixed. And I don't think those are going to change. What I do think will change is what we do as humans, though. And so I think that behavior question is a really key one. How to engage people in understanding their environment. What I think is a big problem in the UK, for example, is that here it's February, or it's actually just March. So we have been blessed with a lovely couple of weeks of weather in February, which is normally miserable. So in effect, our behavior is to actually kind of enjoy some of the climate changes that we see, which is an earlier spring, not taking into account that the same process is happening in other parts of the world, which means that either the rains are coming later, or the hurricanes are coming sooner, or etc. So there's the response, I think, has to take into account what people are actually experiencing themselves, physically, if you like, or in their environment, in their community, and find the right way to communicate why we need action on climate change and how we need to build adaptation and resilience. Because I think it's easy for people to think I'm okay, where people are okay, and not to pay attention to parts of the world and communities that are not okay, because people are very differentially impacted. Even when you think about developing a heat early warning system, heat can kill at temperatures that are enjoyable for some people and deadly for others. So if you look at the elderly with cardiovascular disease, etc., and young people who might just be enjoying a lovely 35 degrees and really enjoying it being down on the beach. So very understanding all of those different behavioral responses to climate is local, and that knowledge needs to be embedded. So I support very much the second perspective.
Thank you. Do we have people who've raised hands? I can't be able to see well in terms of the
I
participants.
don't see any raised hands, Bono, at this stage. There's going to be an opportunity after Caradee has spoken to get back to Madeleine and to Caradee.
Okay. Thank you, Madeleine. And as we are moving forward, colleagues, I see, okay, there's a comment to say this is not a question, but I appreciated the, hey, I can't read that word.
Caveats.
The caveats attached to the pathway when making a AP association between climate and health. Initial assumptions matter. Thank you, Chantel. As we are moving on to the next presenter, hopefully those who will still have questions, they will either put them on the chat or they can raise them when we are done with the next presenter. Our next presenter is Dr. Karadji Wright. Karadji Wright is a senior specialist scientist at the South African Medical Research Council, leading the Climate and Health Research Program. She is also an adjunct lecturer at the University of Pretoria, also a research associate at Nelson Mandela Metropolitan University, and a senior research associate at the University of Johannesburg. Her research focuses on environmental health in Africa, with a focus on understanding climate change and health impacts to inform interventions. Caradee has published more than 100 research articles in peer-reviewed accredited journals. Caradee is a committee member of the World Health Organization Air Quality Guidelines Committee. She's also a council member of the American Society of Photobiology, an intergovernmental panel on climate change assessment report 6 Africa chapter author. She is also with the United Nations Environment Program Synthesis Report 2021 writer. She is the author of the recently published UNEP Frontiers Report on Preventing the Next Pandemic 2020 and a member of the Lancet Commission on WASH. Can we welcome Dr. Karadji Wright as she presents to us on aspects that looks at climate change and health in South Africa. Over to you, Dr. Karadji. Thank you.
Thank you very much, Bono. And it's a real pleasure to be with everybody today, and an honor to present following Professor Thomson's presentation a moment ago. I'm trying to make sure that my slides go to full screen. And can you see if I move away minimize the zoom, it is not interfering with the slides? Is that right?
That's all good. All good.
Yes.
Okay, great. So thank you very much for the opportunity. I have tried to craft what I'd like to say, building on from Professor Thomson's presentation. And many of us on this event today, I've looked through the participant list. There's many colleagues and friends and names that I recognize. And we all know that conducting climate change and human health research is critically important at this point in time. Even though we're living through a pandemic, and many of us have switched our attention to research that is trying to save lives in this pandemic, the ongoing need to address climate change and human health impacts remains. And it's actually really tough to find the data to do the research in climate change and human health, because we need evidence in the form of large, reliable data sets for both climate and human health outcomes at different spatial and temporal scales. South Africa is a country of diversity. We have 9 provinces, 11 official languages. We have 10% of the world's plant species and 7% of the world's bird, reptile, and mammal species. Many of these are endemic to South Africa, making us quite unique. South Africa is also a country of extremes. Just this morning in Pretoria, where I live, the minimum temperature was 14 degrees and the maximum was 27. This makes getting dressed in the morning quite a challenge. More alarmingly are the projections that we're seeing, rapidly rising temperatures in Southern Africa. Some places will see, on average, a 4 degrees Celsius warming of ambient temperatures on average, and an increase in the number of hot days and heat waves. The projections on the right by the CSIR illustrate these warmings. In some places, it will experience as much as 5 degrees Celsius on average warming by the end of this century under different RCP scenarios. We will also likely see more heavy rainfall events accompanied by flooding. We're already experiencing some of this in our major cities, as well as in Limpopo recently. Yet on the other hand, we are seeing severe drought. For example, what was experienced in the city of Cape Town, and in fact is still going on in some of our provinces today. Air pollution and dust storms also prevail. And whether we are capturing these because we're more aware of them and they were always there, or they are actually increasing in frequency, is difficult to unravel without data to be able to understand. Compounding climate change threats are inequality, poverty, corruption, and a quadruple burden of disease that we face in South Africa. This burden comprises of HIV/AIDS, diseases related to underdevelopment, such as malnutrition and stunting, particularly a concern among our children under 5 years of age, chronic non-communicable diseases related to lifestyle changes, as well as injuries, many of which are related to crime, which is extremely high in our country. The diagram on the right shows how we cannot think in isolation when we consider climate change impacts on human health. Environmental conditions, social determinants of health, and a failing health system, much of the time, at least from the evidence that we see, all modify the direct and indirect exposures from meteorological and climatological factors that can influence and affect human health. If we reflect on what climate change might mean for South Africa, there are several changes that will occur. For example, higher levels of exposure to heat, changes in disease profiles and seasons. The malaria season may start earlier and occur in different places. The already stretched public healthcare system may face additional setbacks given its current inadequacies and without adequate preparedness. Possibly some of our key concerns going forward are heat impacts, vector-borne diseases, mental disorders, malnutrition, and cardiorespiratory diseases. Information and data are key, and this has been illustrated by Professor Thomson's presentation. So where do we start? As climate change and health researchers, we need to strive to gather data so that we can make meaning from that data, generating evidence and ultimately leading to action. Such action could be interventions or it could be policy making. For example, as Bono mentioned in the beginning, to help shape the National Heat Health Guidelines and the second Climate Change and Health Adaptation Plan for the next 5 years. One of the first nationwide studies that has been conducted in South Africa used 20 years of temperature and mortality data to assess the proportion of deaths attributable to low and high non-optimum temperatures in each district municipality across the country. Nationally, the total attributable fraction from non-optimum temperature was relatively small at 3.4% and about 0.4% for heat. It might sound low, but when one considers that there were 8.8 million deaths during that period of time, it's certainly not a small number for the number of loved ones that we lost. But if we look closely, some districts carry a far higher burden. The red and dark orange municipalities in Limpopo and Northwest, for example, in terms of heat mortality, and parts of the Western Cape and the Free State for cold mortality. Fortunately for this study, we obtained temperature data from a variety of sources and mortality data from Statistics South Africa in order to conduct this work at municipality level, that is. If we turn to an infectious disease, and this time at a local level, access to data is a completely different story altogether. This is Limpopo province, situated in the northeast part of South Africa. Limpopo is one of the worst off socioeconomically provinces in the country, despite being one of my favorite to visit. It's extremely beautiful. Air pollution and water pollution pose exposure threats to thousands of people, especially vulnerable children and women. We aim to gather climate-sensitive diseases data from hospital admissions. Here you see an example of a page from the hospital admissions book, which we scanned, printed, and then entered manually into a data set to try and generate a database that we could use. And we compared these with meteorological data from nearby weather stations to explore relations between two health outcomes that I was particularly involved in. That was pneumonia and diarrheal disease. And ultimately, with the goal of developing an early warning system. The first hurdle, in fact, was capturing those handwritten hospital records, all 45,000 of them, for a 15-year period of time. With an enormous effort that is in fact still ongoing today, and now using a variety of different statistical analyses, we did find some associations between temperature and rainfall for diarrheal disease among children under 5. The plot on the left illustrates these anomalies. Diarrheal disease occurred not only when conditions were drier than usual, but also when they were wetter than usual. The value of these hospital records was evident, and several co-learnings emerged as we worked with these data and the hospital staff. We experienced missing books, loose papers, handwritten entries, and personalization of how outcomes were entered, duplicate entries for the same individual, and a multitude of errors. Yet, knowing the value of these data, we encouraged a move to digital, securing data for at least 10 to 15 years, and the real importance of training staff in how best to make use of the time, often the little time they have, to capture and record these data, which can be so valuable. Not only do we need to be creative in how we gather data and how we use it while we continue to advocate for digital data, we also need to move beyond the academic exercise and translate our research into meaning to inform interventions that can support resilient, healthy livelihoods. In the quest to prevent adverse health impacts from climate change related events and change, we must make information relatable. How do we get data from people, whether they are the public or the custodians, for example, of meteorological data, and then make meaning from those data that can feed information back in a way that will ultimately lead to positive change? I've used an example here of a full circle where someone perhaps completes a questionnaire on their phone, or a nurse adds patient information into a book, ultimately onto a tablet or something similar. The person wants to see what is done with that data to create information. How does the information that is created apply to me or to my hospital? And how can it make my life easier and my life better and my job easier? People are not complacent anymore. They want to understand where their data goes. In line with the World Health Organization and the South African National Department of Health recommendations, at the MRC, we are focused on gathering data to inform interventions that help especially vulnerable people and settings at risk of climate change impacts. In a new series of implementation science projects, we plan to collaborate to climate-proof various places where people spend significant amount of time. By understanding people's challenges, together we will work to prevent adverse climate-related health impacts in taxi ranks, as illustrated here, in schools, clinics. I spent this morning with the South African Taxi Association and taxi industry, as well as the command structure for transport in my province and in my city. And we really, at the end of the meeting, concluded that together, knowledge and action can create positive change. Finally, we have many opportunities to build the foundation of evidence that we need to identify climate change health risks. We should explore novel ways to gather that evidence and work collaboratively to strengthen our healthcare systems, to prevent adverse exposures, situations as we see here on the far left, where water is not provided continuously. It runs sporadically during the day or the night, and it's only when somebody is there to collect it that it actually has value for people's lives. Or on the far right, where it is so hot in the Northern Cape province, people put their beds outside to sleep. These are the situations of exposures that we need to change, ultimately to support happy, resilient communities. I thank you.
Thank you, Dr. Caradee, for the presentation. Can we actually see if we've got clarity-seeking questions regarding the presentation that she has just shared with us in terms of climate change and human health impacts? And I think she has spoken a mouthful in terms of what areas are we supposed to be looking at, or what are the challenges that as a country we encounter when it comes to issues that has to do with climate change and health. Do we have questions? I think I've noted. Okay, Neville.
Yes, there is a chat question. I'm not sure if it's directed at Caradee, but we can start with her. And the question is from Tariq, who asks, because climate change has and will continue to have a devastating impact on the lives and livelihoods of people across the world, do health and climate change campaigns ever include mental health components? And if so, what form of mental health considerations do they take? And I know that Caradee did mention something about mental health, so perhaps it's appropriate that you start there, Caradee.
I can certainly try and do so, but only from an anecdotal example of my own experience, and then I'll hand over to Professor Thomson, who probably has some thoughts too. When we've worked in clinics where in the Limpopo province, which is extremely hot, we have tried to understand especially why mums carrying babies wrap their babies. They swaddle them very tightly, despite it being very hot. In actual fact, that heat can be adverse for the health of the little one. And it's often the mum doesn't want the child to get cold so that they would be sick. And they think that even though the temperature is hot, because the baby is so small and helpless, their way of protecting the baby is to wrap the baby very tightly and in many, many blankets. And that is in fact a mental health concern that is linked with climate and health. It's a mum concerned for her child's health and not really understanding that the child would actually be okay in a vest and less clothing. So in the materials that we've put together, now that we understand where this is coming from around the concept of protection, and to allay the mum's fear that the baby is not going to be hurt, many of our materials and the work that we do speaking one-on-one with people is to try and address those concerns for mums. That's just one example that I can think of, and I think there's plenty more that we can do in that space. So that's a really great question.
Madeleine, you're muted.
So perhaps in answering that question, and thank you very much, Caradee, for a wonderful presentation. And I did absolutely the right thing in terms of not trying to pretend that I have anything like the local knowledge that you have and the experience of doing things on the ground, because at the end of the day, that's where the rubber hits the road, and where you need to have the results that are tailored to very, very specific situations. But there is a question in the chat about the Wellcome Trust's strategy on climate change, and that relates directly also to the mental health question. So I thought I could answer those both at the same time, if that's okay.
Yeah.
So the Wellcome Trust announced its new strategy, and it's a long-term new strategy. It's not like a 5-year plan. It's a major shift in the way the Wellcome Trust works, thinks, and intends to act in the future. It went through a science review for about 18 months, and basically asking the questions like, is the science it does, and it funds a very significant amount of global science through institutions in the UK, but also through institutions around the world. Is it funding not only top quality science, but the right science, the science that's responding to particularly important questions? So not only did they review the science, but they also had major questions to scientists around the world, both those who are funded by Wellcome and those who are not funded by Wellcome, to say, what are the biggest challenges that in health that we face? And through that process, they came up with 3 major challenges: infectious disease, which Wellcome is well known for and has done a lot of work in. Mental health, which is something that the Trust does work on, but this brings it to a whole new level. And climate change, expressed as global heating and health. And so the 3 challenges, if you like, sit over the discovery science, which is the major underpinning science that is needed for developing the challenge areas, if you like. So more the blue sky science as in discovery, and then these 3 challenge areas which are focused on impact. The idea in the new strategy, and this is still fledgling, but it's definitely, is that there will be cross-cutting efforts across the challenge areas and discovery, such that one would expect that the climate challenge area will work directly with the mental health area and identify areas to invest in. It will also be working directly with the infectious disease challenge area, which is focused on escalating infections, to find areas of synergy. And then we have some cross-cutting structures that are important. One is on data for science and health, another is around translation, etc. So this new structure is very much work in progress at the moment. We're in fact in the team that I lead, we're in the process of being reorganized into the new structure is something we're waiting to see exactly how that's going to work. But what it does mean, and this is absolutely certain, is that Wellcome is going to be focused on climate and health in the short term and in the long term. And that's going to be a really significant area. And then in relation to mental health, there's a whole range of opportunities. I think one of the issues, of course, is and maybe particularly for young people, is the concept of, in the West, is around eco-anxiety. Like if we think that we've sort of blown the planet, what is my future like? So that is particularly prevalent, I would say, in northern countries amongst young people. There was a recent survey in Africa where climate change of young people, where climate change was generally seen as important, but other areas, jobs, poverty reduction, etc. Opportunity, absolutely essential. And I think everywhere that we go, we'll have to identify what is global, if you like, what is common to us all, but what needs to be particularly emphasized in different areas. So I don't think it's just all about eco-anxiety. I think there's a lot of other mental health issues. I think there's ones around decision making. And I spent 17 years in the US, so I follow the US politics quite closely still, even though I'm now back in the UK. And one of the things that you see is that when under a lot of pressure, such as with COVID, leaders sometimes make poor decisions because they don't have the answer. They don't know what to do, so they make a suggestion and they go with that. And you could say that is a mental health issue as well in terms of dealing with anxiety, of not being able to solve everything. People come up with solutions that they think other people will buy into, which can be incredibly unhelpful. So I think thinking about the impact of climate change on decision making, and as anxiety about climate change will grow, and that is definitely something that is going to happen, there'll be more and more focus on it. Hopefully the anxiety will mobilize action, and the action itself will promote good mental health, i.e. for us all to be engaged and proactive and building communities that are resilient and adaptive and also mitigating the climate. So I think there's mental health has opportunities, if you like, of intersecting with that across the board.
Thank you, Madeleine. And I think also I can indicate that as a department, we have that included in our adaptation plan and heat and health action guidelines to put more focus also on areas of mental health. So as and when it gets to be approved, we will definitely ensure that there's capacitation of stakeholders in terms of the implementation, in terms of the approved document itself. So it's included, and it's something that is very key, that we have seen that it's key to be addressed when it comes to climate change. Can we move on? I see there are other questions, others were just comments.
Can I read one question, Bono?
Please.
Because I think there might be an answer from you, but I also have something just to add to an answer. And the question is from Charles, who asks, is there evidence in South Africa the government takes into consideration climate change factors when taking decisions, especially as far as service delivery is concerned, example, housing projects, water, sanitation, provision, etc.? I just wanted to say that I'm aware of the Green Book, which is a product or collaborative project by several partners in government, which was produced and is ongoing with the CSIR. It's called the Green Book. It's a planning document which does in fact take climate change and other developmental issues into account. So I know about that. I wanted to mention that, and then perhaps you want to take that as well. And I'm not sure if Caradee has a contribution. And then let me just add the second question, which says, given the severe lack of vector control, especially at local government level in South Africa, and given the very real issue of climate change in South Africa, will the South African Department of Health be improving this service? I'm not sure who can answer that here, but those are the two questions, Bono.
Oh, okay, thank you. Maybe can I give to Caradee if she's got any input on the first one that talks to issues of housing projects, water and sanitation. I know that we also have colleagues who are coming from Department of Environment, Forestry and Fisheries, who are the drivers of these. And as you responded in terms of the Green Book, all departments that are affected when it comes to climate change activities, they are included in that, and their activities are also included. Maybe responding to Charles Koto, it's to say he needs to engage with the Green Book and also other documentations that talks to climate change and sector departments that are within the climate change sphere as identified within the climate change sphere in South Africa. Caradee, do you have any input before I can go to the one for vector control, or maybe From Deaf, I saw Faith. Are you still here, Faith? If you can just.
Yes, thank you. If you can hear me.
Yes, we can.
Okay, no, that's perfect. I think on what you've just mentioned and with regards to the Green Book, I mean, as the National Department of Environmental Affairs and Forestry and Fisheries, we really do support the tool to the point that I'm not so sure if ever we have colleagues from Human Settlement right now. What they've now been busy with is they're currently developing what they call a special development framework. I'm not so sure about the name, where they are going around the country selecting specific zones where they're gonna expand the development of RDP houses and so forth. So what we've then done as the department is that we then provided inputs into the document where we had to make sure that they align with what the Green Book is saying. Because remember, the Green Book, over and above everything, as much as it's a climate change tool, but then I think it's a tool that is meant to support special planning within the human settlement space. So we are very much in support of that tool, and we are working hand in hand with the Department of Human Settlements to ensure that that tool is mainstreamed into whatever decisions that they are making. And moving forward, what we are also trying to do as a department is to roll out the Green Book itself to our local government municipalities. So for this next 3 to 4 financial years, we will be busy with the rollout. One of the outcomes from one of the meetings with our minister, which was last week, she requested us to make sure that by end 2022-23, we should have made sure that the Green Book is rolled out within all the 44 district municipalities in the country. So that's the plan that we are doing in terms of making sure that climate change issues or climate risk are embedded in all decision-making processes of the government. So yeah, in a nutshell, that's what we are doing right now. Thanks.
Thank you, Faith. Caradee, do you still have any addition or it's okay?
I would like to add something.
Okay, thanks.
Hello, Prof. Charles. It's nice to see you. Thank you for your question. Because I work in communities, I haven't got the high level national perspective, but I can certainly tell you that in Case municipality in the Northern Cape, there has been an excellent initiative between government and the provision and a housing project where I showed the picture of the bed outside of the homes. In those communities in Case, and I'm pronouncing that wrong, it does have a something at the beginning. It's in the Northern Cape, west of Uppington, where roofs of houses have been painted with a special coating. It's a white coat of paint, but it's thermally very good, and it can reduce indoor temperatures of houses by up to 6 to 8 degrees Celsius, which transforms people's lives. I've told this story before, but it has a huge effect on me. The mum was sitting outside under a tree in her bedroom on her bed with a baby lying on a pillow, fortunately just in a vest because it was very hot. And she told me that she couldn't wait to have her roof painted because she would then be able to iron her clothes indoors and not have to iron her clothes outside because it was just too hot indoors. So I do believe there are examples where our government is thinking about climate change in housing improvements. And then the other one around vector control, Neville, I'm sure would be better at telling this than me, but in the project that I spoke about with the hospital records, that project was also about an early warning system for malaria, and working very, very closely with local municipalities as well as the Limpopo provincial department. The data analysis that was done in the modeling actually led to the early intervention or the earlier spraying ahead of schedule because there was an alert raised that the season was coming earlier than before. And so actual intervention change happened by that department and the people who are going out to do the spraying. So there are some very real examples around the country.
Bono, can I intervene there quick?
Yes.
So add something there, and then if I may ask a question for Madeleine, if that's possible. Can I do that?
Yeah, it's fine.
Thank you. Just very quickly to say that there's an impressive vector control, specifically for malaria, program in the country, in Limpopo in particular, which we are very familiar with. And they are often victims of their own success, because when they spray and there's a low malaria season, you can't really attribute that to them. It's a complex story because there's all sorts of controversies around it. But just to say that the COVID year, last year, was a big problem because they could not gather people to go and spray. But we haven't had a malaria response that I'm aware of as a consequence, although now, of course, we've got all the rains because it's a La Nina year. So it's an interesting question, but I would say that in particular for malaria, vector control is well managed in this country with its limitations. However, it's not the only problem, it's not the only driver of the malaria problem. We've got other issues like migration and so on and so forth. My question, if I may, Madeleine, is about extreme events. It's well that we look at the changing trends in climate and the changing relationships, but the extreme events, which are effectively happening more intensively, which is more frequently with higher frequency and so on and so forth, I mean with high intensity. How are those important in understanding trends in climate and disease?
So think about, so different diseases obviously respond differently. So an extreme events such as a flood that results from very short-term heavy rainfall is one thing, and it would likely produce different impacts depending on the way water works, whether it's a coastal region, whether it's and you're having estuaries fill up, or whether it's a large river system, or if you're up in the mountains and you'll get these flash floods and what have you. What you'll tend to get from an infectious disease side will be a buildup of rainfall over time. So not just one extreme event. And I think so the shocks that we get result in certain types of health disasters. And some of the health disasters that we get are, if you like, from aggregate shocks. And you have to think not only what's happening today, but what's happened over the last week, months, and sometimes years. Even with heat stress is very much not only what's happening in the atmosphere, but also what's been happening on the land. And if the land is already very dry and you've already had a serious drought, etc., then your heat stress is really going to build up. So one of the issues around impact, as opposed to just looking at the weather system, is you've got to know what's been happening in this place in the previous weeks, months, etc., and what is specific to this particular location. Why is this location particularly at risk? So I think that's where extreme events, and I think heat stress is a really good example of that. You can provide temperature data for heat stress, but heat stress itself is very different, has very different impacts depending on the history of heat in a particular area, how well people are adapted, and the mortality rates in some regions don't kick in until, you know, they're up above 30 degrees. In other regions, they kick in at 20 degrees. So I think always with extremes, you've got to think about everything is in context, and it's not only what's happening that day, and then all the vulnerability issues. As extremes increase, so we see some, we're not always exactly sure, and this is, I'm sure there are plenty of weather and climate people on this call that will know this a lot better than I do, but my understanding is that for certain extremes, we know there's a very strong climate change signal, particularly around heat stress, for instance. For other extremes, we're not so sure, and very often the data is just simply not good enough to tell us, because from a climate perspective, we really need a long history of data of that particular type of event. And for many parts of the world, that information is just not there. So then we're dependent, if you like, on more theoretical relationships to say that, yes, it's very likely that this is a climate change event. From an experience base, though, who cares whether it's climate change or a weather event? We experience that integrated phenomena, and we have to respond to that integrated phenomena. So, yeah.
Thank you, Madeleine. Maybe just to conclude, the one that spoke of vector control, Yes, for malaria, we've got a very good program in the entire country with focus on the 3 endemic provinces, Limpopo, KZN, and Northwest. And also those that are not endemic, the program is running well. But I think for other vectors, maybe that's where we are a bit lacking, but maybe one can indicate that as a department, we are part of the One Health Committee, where we have different stakeholders that are sitting and deliberate on issues that has to do with vector control. And those are our academic institutions and research institutions and department that are a part of that particular committee. But what is of importance, I think, in terms of ensuring that our local government, these get to be implemented, we have a strategy that we are finalizing as a department that will assist us in ensuring that we get to implement the services and at the same time also monitor the implementation within all the 3 spheres of government. So I can respond to say, yes, Department of Health is part of that, and definitely in the long run, we would have improved the way of implementation of this particular service within the country. The next question, I think when we answered the question that was asked by Charles Otto, the Green Book and all those particular documentations that we have, I think he's got a follow-up question to say, yes, he has read all these documents, but his concern and the question is whether there is evidence that the relevant spheres of government and departments take this into account when implementation is concerned. Yeah, I think it will need faith to try to assist us also on that one, whether when we look at human settlement, sanitation and water department, whether we have implementation and how do we then monitor whether these are taken into consideration. Faith, if you can quickly respond to that. Thank you for availing yourself also.
Thank you so much, Chair. I just need to be honest. Mainstreaming of climate change initiatives is a bit of a challenge. I think it depends at what level or at what spheres of government. I mean, the reality is that I think our local government sphere, particularly our cities, take climate change mainstreaming into consideration. I mean, I'll make an example of the city of Tshwane, where you have a city that takes sustainability issues or climate resilience issues so seriously that they even established an office that sits closely to the mayor's office, you know, so it's attached to the mayor's office. And then you look at a province or another district where they don't even have an official that can even talk about climate change issues at all. And already it means then the mainstreaming of those of climate risk or any other related climate change intervention would be a bit of a challenge for that district municipality. So honestly, I don't think as a government we're doing very well when it comes to mainstreaming climate change into decision-making processes. But I think it's better than what it was if I were to say 4 or 5 years back then. Now I think we are trying to like really push it to say that, look, you cannot keep on doing things the way you've been doing them.
She froze.
we are losing you, Faith.
She froze.
Yes.
Chair, can I suggest we have time that we have more question which is directed at Madeleine, which if I may read, Chair, that we directed her and then asked for.
And luckily, a lot of cities have seen serious climate change impacts to decision making. So maybe it might be an issue of how do they go about doing it. And sometimes they don't even have the person.
There's some legacy coming in. Okay, let me quickly read this question, Chair, if I may, and then we can wrap. Okay. So, Madeleine, the question is, can you please say something about migration, taking into account the EU and Central American migration examples and how they may be linked to climate change? I'm not sure if you feel qualified to address that, but I hope you are.
Well, if I'm not, then I know somebody who is. So that's so I'm going to paraphrase what they might say. I think that there have been a number of studies that have created. I mean, there's a if you like, it seems obvious that if you're in an environment where there's largely agrarian population that is dependent on good rainfall for crops, etc., that there will be major social issues if the rains don't come, and drought in particular is a huge challenge for rural populations. There's evidence for the Syrian conflict, for instance, that with the droughts in Syria, which does seem to be a significant climate change link, because in Northern Africa and Southern Africa, it seems to be the climate scientists, from my understanding, are fairly certain that there's a drying trend, and that the Syrian droughts resulted in the move of populations from rural areas into the big urban areas, and that associated with food spikes at the time resulted in conflict and considerable conflict and disruption into the region. It's not to say that climate is always the only driver, but often climate can contribute as a driver into a political unrest, etc. There's also some good studies that have been shown that drought in Central America has resulted in populations being moving northwards to Mexico and the United States as a result of social disruption and drought impacts on agriculture in Central America. So the institute that I worked on in Colombia had a particular focus on drought and climate change and population movement. So whoever, Rico, you maybe look at Colombia's website, you'll find some sources of evidence there. I can't for the minute think who the name of the person I should put you in touch with, but that has been a focus.
Okay, thank you, Madeleine. I'm no longer sure if we still have questions on the chat. Neville, are you able to see something there?
No, Bono, I think we can conclude, but there was
a
suggestion that in your conclusion, you say something of the implementation strategy. I think it says. I'm not sure.
Oh, okay.
Yeah.
Okay. Thank you, colleagues. Thank you all the stakeholders who attended this, and I think to Neville and Access and Department of Science and Innovation, we really appreciate this engagement that we had. When it comes to strategies, I would just indicate that we will be able to implement once it has been approved, and definitely everyone will be able to get a copy of that or be able to download it. And it will definitely be able to assist going further in terms of the activities that need to be done in responding to climate change. The same with vector control, as I've indicated. So we really appreciate, and I think for further clarity, because I believe that others maybe might not have been answered to their satisfaction, please engage us. We will be able to refer you to the relevant stakeholders that can be able to respond the best way that is possible. So on that note, thank you, and back to you, Neville, and thank you to the two presenters. We'll engage further. Thanks.
Thank you very much, Bono. Thanks for chairing that for us so well. And thank you very much to our expert speakers, Madeleine and Caradee. I will make this session's video available online. It'll be on our YouTube channel, and I will email all the participants as well as those that registered so that they can see this video and the others that we have from our other sessions. And I'll end it there just to say that there will be an announcement about our next session once I've lined up the speakers. And I hope and trust that we will return to this topic in more detail in the months to come. So thanks all very much for participating, and thanks again to our speakers and chair. And cheerio.
So, thank you.
Thank you.
Thank you. Bye.
Bye-bye.
Thanks, everybody. Take care.
Bye.
I'm going to end it in 5 seconds. 3, 2, 1. Bye.
Bye.